Hi, everybody. It's a pleasure to be here. I'm really excited. This is the first time I haven't had to talk about just business, and I'm a bit bored of business, so we're actually talking about results, which is what I'm the most passionate about. So just to give you sort of a little bit of background about how I came to be talking about results when I'm not a doctor. So my background is 18 years in health in the UK. I've done all sorts of health roles. I was the first non-doctor partner in general practice. I opened the first drive-through pharmacy in the UK. I had 12 weight loss clinics. So although you all know me for Australian skin clinics, I had a whole life before that. One of the things I did do was I was involved in drug trials. And then I've had 18 years in aesthetics now, so it's nearly 18 years since I came to Australia. And then I founded, obviously, the Australian Skin Clinic franchise. So currently, I still have that very original Australian Skin Clinic, but it has a new name, and that's on the Ashmore on the Gold Coast. And that clinic was always very different to the franchise one, so you'll understand that in a moment. I since bought Isada Mineral Makeup, and we launched Isada Clinical Skincare in 2020. And I sit on the board of several companies, Grow Clinics, hair transplants, Aura Medical, who are rolling up dermatology, skin cancer, and aesthetic clinics. So that's kind of my background, and that's how I came to be talking about Clear and Brilliant and increasing revenues in your practice. So that very first clinic is now called Ultimate Skin and Body. Not quite as sexy as Australian skin clinics, but there you go. And that clinic's been trading for 28 years. It was first owned by Dr. Doug Groves, some of you may know him, and I bought it in 2007. We were the first Fraxel clinic in Australia, and Dr. Groves wrote all the procedures around Fraxel, and he tested the different numbing creams, and he wrote the protocols. And we've still got Fraxel now, albeit the newer version, and we have a huge variety of treatments, so we've probably got everything that you could ever need, or so I thought, to deliver the treatments of the everyday common concerns about the skin. So I'd been nagging Salter for a while to get Clear and Brilliant Touch because I'd had a treatment when I was over in the US at a conference about 3 years ago and was so impressed with the results on me that I wanted this machine. Eventually said to them, if you don't get me that machine, I'm going to go to Vegas and bring one back myself in my handbag because it's a Cat3 laser, I can do that. And they said, no, okay, we'll get you one, and they did. So we've been trialing this machine for Salter, so I declare my interest there. And we absolutely are loving it, and I'm going to show you some results that are going to blow your mind today. But why did I want this? And really, I felt there was a gap. So we have Fraxel, which is like the high end. We call it the big guns, and that's how we refer to it with the patients. We're going to give you the big guns. And it's great for the deeper treatments, for the ice pick scarring. But in terms of like the superficial repair and the superficial rejuvenation, just not quite hitting the mark as well as I wanted to hit it. We've got mild micros, peels, HIFU, laser veins, IPL, fractional RF, evoplasma, like we've got it, and the t-shirt. Perhaps not as many as Eric's got over there, but we've got a whole range of treatments, but we were looking for something else. And the day I had that treatment in the US, it blew my mind. I said, this is what I need. We've also, in our clinic, we used to have skin cancer services, and we had cosmetic surgery. So I've also been involved in those level of services as well. So what were the gaps? Our two top-tier revenues in terms of devices is Fraxel and Evo. But especially at the moment with the recession biting in, they are the top end. And so not everybody is going to go for that. The mid-tier is your fractional RF, your HIFU, and injectables. But really, they used to be the top tier. When I launched the Australian Skin Clinic franchise, they were the top tier, but the world is changing. And then the lower tier, the micros and peels and microneedling and IPL, well, everybody's doing that, everybody and their dog even. So those are getting cheaper and cheaper. It's like John was saying earlier, when you've had a piece of equipment for a while, the amount you can charge for it is going to reduce. So I wanted something that was not higher than Fraxel and Evo, because we already know that's a narrow market, And I wanted something that was a lot higher than the IPLs and the micros and all the other things, because they've become like the common denominator of everybody. And that's where I think Clear and Brilliant sits. It's the new mid-tier. So the business case. It treats all ages, all skin types, all skin colors, and all year round. So my demographic in my 28-year-old clinic is now getting quite old. In fact, a few keep dying off on me, all right? So you'll see that in the photos. We have a lot of the older, wealthier lady of the Gold Coast. It treats all skin types, which is important. In the Gold Coast, there's not that big a variety of all skin types, but it's still a good thing to know. And it treats all skin colors. So already, I feel like the market that you can pitch it to is everybody. And that's, you can't do better than that. It's affordable, and we'll talk about pricing shortly. And the downtime is minimal. Fraxel downtime is between 4 and 7 days generally, and in some cases 10 days, depends what you're treating. But the downtime on this is literally a day, which is incredible. It's less painful than Fraxel. It doesn't need the 27% numbing cream that we have to apply, and we have to get a nurse to apply because it's an S4 drug. And the client sees much faster results. So with Fraxel and Evo, you're talking about results developing over a 3 to 6 month period. They're seeing results in 7 days. And all the photos I'm going to show you are taken at 7 or 10 days after treatment. 7 days was our target, but sometimes a weekend got in the way. Clients are not dreading the next treatment. I have had occasions where we've gone for Evo or we've gone for Fraxel, and they've perhaps bought a package of 3 and then got to 2 and then said, I can't deal with another one. And in fact, and it's not common, it's not an everyday thing. I'm not saying it to put you off, but it does happen. Since we've had Clear and Brilliant, which is literally a couple of months, we've had customers who've had Fraxel previously say, can I trade it in for Clear and Brilliant? Results are median, and the return on investment is good. I'll take you through the numbers shortly. And really importantly for Queensland, it's a Cat 3 laser, so there's no requirement for a laser license, which is the bane of all the clinics in Queensland. So I want to talk you through our process, because the one thing that I have learned, and I don't just say this because I now own a skincare company, that came after, but the one thing I have learned is that with every single treatment that we do, prep is the most important. And it's most important on multiple levels. One level is making sure you don't have an adverse event because you're prepared. And the other one is getting the client engaged in a journey where they're looking forward to the next step. And one of the things I teach my staff to do is, to talk today about the next things we might be looking at later, to give the client this sort of view of a journey they're going to follow down. Because if you only talk about one thing at a consultation or one treatment, they think when they've had that treatment, they're done. And yet we all know that combination treatments over time are the most successful. I'm 60 years of age. If you look back and Google me and look at my photographs of when I was 44, I look a good 15 years older then than I look now. And I've not had any amazing treatments. I mean, yes, I've had Fraxel, not for 6 years at least. It's just small, consistent, ongoing treatments that make the difference, and good skincare. So what we do for Clear and Brilliant, we followed almost exactly the same progress from the consultation through to the treatments as we did with Fraxel. So our consultation is very thorough. We go through everything. We talk about lifestyle, we talk about medications, we talk about any problems they've had before, any treatments they've had before, what has worked, what hasn't worked. And we try to get to know right down into that person. Now, I know if you've got a smoker, for example, if they're a 20-day, 30-day smoker, you'll probably see 50% of the result of a non-smoker. It's just a fact. So this is why I like to get down into all these things in consultation, so that you can advise the client more carefully. And also get a degree of their satisfaction level, and whether they're unhappy because something wasn't done properly, or they're unhappy because they're an unhappy person. It's always helpful to know that in advance. And then we put them on a course of preparation treatments. Now, we've never treated anyone on the Fraxel above a FITS 5, but we are Well, yesterday, so I can't show you the results, but I can show you her face. Yesterday, we treated our first Fit 6 on Clear and Brilliant, and that is incredible to be able to do that. And that's probably more important for those of you down here in Melbourne and down here in Sydney and in Melbourne, because you've got more darker skins than we have on the Gold Coast. But still, being able to treat a Fitzpatrick 6 is incredible. So the pre-treatment prep, and if you want to take one away, I actually brought samples and they're on the Clear and Brilliant stand in their goodie bags. So we have a 5-prep program, and this was designed because when I first bought the clinic all those years ago, we used to use a prescription depigmenting gel to prep the client with, but it had a very similar response to prescription strength retinol, which is very poor client conformance because it made them flaky, itchy and sore. And although it really worked well, they didn't like it, and it used to make them feel tight and dry, and it sort of didn't help. So we based this program has got, I think it's 3 tyrosinase inhibitors, 5 cell turnover aspects, and it's incredible. And if anyone wants the detail later, I'll give that to you. But we have them on this prep program of 5 products. Now, if you're pale face like me, 2 weeks is enough for Fraxel, and so we adopted the same for Clear and Brilliant, 2 weeks again. If you're darker skin, Mediterranean above, we're usually prepping for 3 to 4 weeks. And because we've never done a Fit 6 before, we made her prep for 6 weeks, which is why we only did her yesterday. What we find when we do that is, first of all, you're building the expectation that you've got to do some work yourself, because once they've had whatever treatment that's taking away their pigmentation or rejuvenating their skin, they are going to have to maintain it. So we try to get them into good habits beforehand. And then the second part of it is they start to see results in those first few weeks, before they have their treatment. They instantly trust you. They know that you're telling the truth because they can see it. And in fact, in the case of my Fit 6, within about 4 days, her family started saying to her, your pigmentation's going. Personally, I couldn't see the difference. She actually works for me. I couldn't see the difference, but she could, and that's what matters, okay? And so we also have to be really careful about heritage. And this, I didn't know this till I came to Australia, that you can have a dark heritage and still be very, very white. So, we always treat to heritage, not just the color we see. So if anyone has got Maori or Aboriginal descent, we always treat to that skin. Otherwise, you're at risk of pigmenting them. All right, so this is our prep protocol. So it's a glycolic, we call it polishing scrub, even tone pigment serum, which is the one with the 3 tyrosinase inhibitors and fast cell turnover ingredients as well. Enzyme resurfacing moisturizer, again, generating cell turnover, lightening and brightening. 1% retinol, we all know why that is, and it might be a news flash here, but retinol is going to get banned in the next few years, so we're already working on a replacement for that. And then we get them to cease the retinol just 3 days before treatment. All right, so that's the prep. On the day of the treatment, we cleanse, scrub, we use acetone to degrease, then we use alcohol wipes to sterilize, and then we apply topical numbing, just the below 10% over-the-counter strength, which is really good. And we glad wrap, and this is my Kenyan lady, and we glad wrapped her yesterday. Why? When you glad wrap, you stop the evaporation of the numbing cream, you get better absorption. Generally, clinics are cold because we've all got air conditioning on, so you're actually keeping the face warm, opens the pores, they numb better and faster. And I had 2 Clear and Brilliants in the last sort of 6 weeks. The first one I glad wrapped for myself because that was for training. And then the second we were chatting and I didn't notice they didn't glad wrap me. And I felt more pain when I was not glad wrapped. So I swear by that. In my clinic, we often sit clients in the waiting room glad wrapped, especially if it's for Fraxel because that's 45-minute numbing. And that actually creates conversation between people, what you're having done. Then we remove the glad wrap with chlorhexidine, and then we wash down again with alcohol because the chromophore for the Clear and Brilliant is water, and you don't want any water residue on the skin. Okay. Our aftercare protocol is one that we've used for a while. So we use ISADA epidermal growth factor just for the first night. And with the Premier handpiece, there's this level, as Eric was talking about earlier, where the skin can, the tissues can absorb more product in that 11-minute window. We tried the vitamin C, which was in the study that Eric also mentioned. I did half and half, so I did this side with vitamin C and this side with EGF, and to be fair, I saw no difference, but they're both really good products. However, if you're using either Fraxel or Clear and Brilliant for post-acne scarring, you probably don't want to put a vitamin C on in case you stimulate a breakout. So I prefer not to put the C on, but that's a preference. And then aftercare, we've got a symbiotic moisturizer, which is a live probiotic, reinstates the skin's biome within 30 minutes of applying, and that's what we use as the aftercare. And then we also send them away with a niacinamide plus B5 serum because that's soothing, calming, and anti-inflammatory. My policy is to bring the client back in the clinic as much as you can and to introduce them to as many people in the clinic as you can. And the reason I do that is because then they get comfortable, they feel at home, and you're front of mind for all future treatments. So at this stage, we use a rejuvenation qualified tech to do Clear and Brilliant. Even though you don't need that license, we do use a licensed tech to do that. But at this point of the comeback, we hand them to a therapist who does this very light peel after 7 days, which is really just about cleaning up any dead skin cells. But we do that predominantly to get their after photograph and check compliance. And then we offer them a complimentary, and that's complimentary, and that takes 20 minutes. And then we offer them an LED 10 days after that with, again, a light enzyme mask, which we have in the range. And again, all of these are in the sample packs. So we have an aftercare pack and a before care pack. And so we do the same, we do this mask, again, to get them back in, to meet another therapist. That would be, the LED one would be the most junior therapist, potentially, and get them used to meeting other staff members so they're happy to come back. Trial clients. So I was really skeptical about my clientele being so old, and would it be as good for all of them? So I wanted to do a whole range of demographics, as many skin types as I could, albeit we are limited in the Gold Coast, but also a range of ages, and importantly, I wanted some difficult clients. And as luck would have it, I have a few of those. And these will be people who've had adverse events either with us or someone else. We've got a couple that had adverse events with us. I'll talk about that in a minute. And who have had previous treatments and who haven't had previous treatments. So we went to a great length to choose the clients we were going to run through this trial. And we also looked at lifestyle, age, and weight and size, and I'm going to take you through each client. So the results, this is my clinic, by the way. It doesn't look anything like an ASC anymore. All right, so this was our kind of easy target. We thought she's not, she's nothing strange about her. She's in her 40s, oh, she's just 50, sorry, this one. She had no real skin issues, a little bit of pigmentation. She'd not had many treatments at all, but she'd had Fraxel, and she'd had LED. But she'd had Fraxel a long time ago. It wasn't that recent. This is 2 treatments, and they would have been done 4 weeks apart. So if you can see here, I don't know how it's showing well there. You can see lightening and brightening of the skin, smoother texture. You can see the nasal labial folds have absolutely lifted. And if you look at her chin, you can see that her pores are a bit smaller. And, I think that's a really nice result for 2 treatments. They get better. This lady, all right, so this lady is 76. Oh, can I just ask that you don't take photos of these? Salter will release all these photos, but they'll be banded out, and I've got consent to use them, but to the general public, they've got to be banded out, so please don't take photos. So this lady, I actually didn't choose her. So there was 2 clients that were chosen by one of my therapists, and when I realized they'd been offered this trial, I said, why did you choose them? You're not going to get a result. And this is one of them. So I didn't think she'd get a great result. She's got quite heavy smoker's lines. She's got quite heavy jowls. I always, when people have got what I call elephant skin, like they've got that thick skin, they need a facelift. There's not a lot we can do, but yet we still got quite impressive results. Again, this is 2 treatments, 4 weeks apart. and they get better. Now this lady, I met her the first week I moved to Australia. So she's a regular. She's been coming to my client to the clinic ever since she met me. She's had Fraxel. She would have had her first round of Fraxel about 7 years ago, and then she's had Fraxel just before Christmas. She is 56 years old. She has been a smoker. Has been a drinker, but she does work on yachts out for like years at a time out in America. So she's highly sun damaged. She's also very skinny. She doesn't eat a lot. And generally, I'd say not the most healthy of people. And she'd forgive me for saying that because we are friends. And we did this treatment. I actually thought when I first put it up, this must be 2 treatments, but this was 1 treatment. And that result is astonishing, given all those factors I just mentioned. Yeah, I think you can see. So if you look particularly around the mouth area, you can see that, the side of her mouth has lifted, her smoker's lines across the top, her lips are less, and even her chin is less, and her forehead is less. So everything about it is improved. She's ecstatic. She immediately bought a package of them, like immediately. This lady is someone I press ganged into coming in because she's in her 60s, she's quite pigmented. She's a lady on the Gold Coast who gets involved in a lot of activities and events, and so I thought she'd be a great person to do because she'll talk about what she's had done. This, again, is just 1 treatment. You can see, again, how much the nasolabial lines have lifted, how much pigmentation's come across. She's still a bit pink on this photo, but she told me that within 2 days of that, the pinkness had gone down. And again, you can see a lifting. You can also see a slimming of the face, and that was the first thing she said to me, was on about day 3, she texted me and said, my face looks thinner. And definitely, and I worried when I heard that. I thought maybe she's got fat atrophy, and in a minute you'll see why that worries me. But I actually don't think she has. I just think perhaps the lymphatic drainage moves some water, and I'll assess that when I see her again, which will be on the 4th of October. This is her sideways on. So you can see there the pigment has faded down quite a bit. I hope you can. If you can't see these things and you want to come later, I've got them on the phone. And then this was another client, again, 2 treatments. She's 68, and we didn't do all old people. I've got some young people coming up. Again, 2 treatments, you can see significant lift into the side of her face, reduction of wrinkles. Not such a great improvement on her pores on this lady, but still a nice improvement. The redness has gone down, and she's got, much more smooth looking complexion. And let's face it, 68, if you can get some improvement, that's great, isn't it? This is another of my staff. So Alana's Maltese, and she's got terrible melasma, as you can see. She's also our head of makeup in Asada, so I've actually never seen her without her makeup on until we did this. So she would never leave the house without makeup. And so she got a nice improvement after 1 treatment. We did treat her a little bit carefully because Maltese can be quite dark, and we just wanted to do her a bit more lightly the first time, but then we had the comfort with our settings to be able to go a bit stronger the second time. But as you can see, the melasma has lifted quite a lot. She's got breakout on her chin. She tells me it was just the time of the month. She would have got that anyway. This is me. I got the worst result, and I had to laugh about that. But I think, to be fair, I didn't prep. So I actually not very good at my night routine. I'll do anything I have to do in the morning. But my husband goes to bed early. And I don't do a night routine very well, and I don't use retinol. So I hadn't prepped, but still got a nice result. I can't deny that. So the other side of me, you can see all the pigmentation's gone down. Front on. I look like I've lost weight in that picture. I don't think I have, I just think it's the picture. And this is my décolletage. That was after 1 treatment. Bear in mind, I'm 60. This is the adverse event I was talking about. So we have evoplasma. I don't know if anyone in here has got that. We were having very variable results on it, and we spoke to the company, and they said, find us 4 clients. We'll come and we'll do those 4 clients and show you how to use it properly because it's your staff. And all 4 clients got fat atrophy, including this lady who's my very best friend. And I'm not sure how that's still the case after this. But her face turned to crepe paper after this treatment. It was horrific. And I didn't think she'd get a result with Clear and Brilliant, and yet if you look at her forehead, look at that massive improvement, and that's after only one treatment. And we actually went quite light with her because I was terrified of making the problem worse. So this was like a real success factor for me. This is my nephew. His mum texted me and said, "What did you do to our Chris, and can I get it done in England?" So that he just had one treatment there, and he's booked in. He's never had any work done previously, and he's booked in for a full course. This lady, if you look at her nose, she's got a skin cancer scar, and ever since I've known her, she's had that scar. And you can look in just 2 treatments, look how much it's faded. Again, we would have used the epidemial growth factors on, which is really good for healing scars as well. And she's in her 60s. So he's an acne scar client. He'd had Fraxel in the past, seeing significant improvement with the Fraxel. He's got a lot of ice pick, give me 1 minute. But again, you can see improvement there. Another client, and very quickly, this is another melasma one. Big difference. Again, as an ex-staff member, she'd had IPL at a clinic she worked at before, and that had made her melasma worse, of course. Another one. This lady, look at how much the lift she gets. This lady, she's 78, and look at that, that's 2 treatments. It's phenomenal. She's one of my favorite clients. She's adorable. She's been coming to the clinic for 24 years. And these are the faces of the people that we've not yet finished. We've still got to either see them for follow-up appointments and get the photos. And so we're doing all of those in the next week. And then this is very quickly the return on investment. So it's roughly about $179.50 to deliver the treatment, which would include your key for the machine, your numbing, staff time. Numbing is probably a bit generous there. And we pitched it at $550, middle of the road. You could probably get more in Sydney. And very quickly, if you work out, sorry, I'll flick through all of these. Come and ask me later if you like. Sorry, gone too far. This is, if you get someone booked in for a course of 6, even putting in the extras that I give, which is that extra peel and so on and so forth, a client is going to give you a margin of $2,871 over 6 treatments, which is quite significant. And I think it's easily sellable at $550, probably down here easily at $650. That's just face, yeah. And then we would do a bit of a deal if they were going to do, yeah. But there's a numbing issue, so you wouldn't want to do it all together, yeah. So a lot there, but I'll be around later if you want to ask any questions.